I think that really for any organization, but especially in healthcare, it's about healing. It's about taking care of people. And I think that starts with our employees. And so for me, the most important thing is as a leader in a healthcare organization, that I set the tone and set the example for how other doctors in the practice or managers in the practice interact with staff, interact with ultimately patients as well. Really, I think what it comes down to is that our healthcare system is not functioning in a healthy way. And it really affects all of us. It affects the people that work in our healthcare system, like doctors, nurses, like every level, actually, medical assistants, all of us. And it also affects the people that have to access care. What we signed up for is not easy. I think it's about character. I think that the biggest tip I can give anyone is, to try to work on yourself continuously. I try to work on myself continuously. And if you make a mistake, acknowledge it. If you have a bad day, we wake up the next day and try to do better. I mean, that's all we really can do. And like I said, it doesn't matter if you're the CEO of the organization or you're the receptionist at the front desk. We all have to have that same mindset. Our model is kind of unique in the sense that we really believe that primary care can serve the needs of people through a variety of different things that would typically be siloed kind of in their own like vertical in healthcare. So urgent care, for example, we feel belongs with primary care. Also, integrative medicine, we believe belongs with primary care. The way that we set things up is that we schedule our appointments at either 20-minute intervals or 40-minute intervals, depending on how much time we need. In primary care, those are longer appointments. Typically, oftentimes 15-minute appointments is more typical. We do that so that we can spend more time with people, but also it also builds in a buffer into our schedule that allows us to squeeze in walk-ins. And so it lets us say yes to people that have urgent needs.
Hello, everyone, and welcome back to Scaling Practice Management, where we help practice managers grow smarter, not harder. My name is Jakub Grajcar. I'm the head of marketing at Talkie AI, where we help medical practices stop the phone from ringing off the hook and unburden their front desk team with AI medical receptionist agents. And we're already helping 300,000 patients every month. My guest today, I'm very happy to say, is Dr. Joy Evers. Dr. Joy is a board-certified emergency physician. She's the CEO and founder of Healthtopia Clinics, and she's the host of the Your Doctor Wants to Quit podcast. Super happy to have a fellow podcast host on the show. Dr. Evers is also an adjunct professor at Bastyr University, California. Dr. Joy, welcome to the show.
Thanks so much for having me.
Yeah. I just wanted to underline you got up real early for this recording session today. It's 7 a.m. your time, I think.
Yeah, it's 7 a.m. Sun just came up, but it's a great start to the day.
I would hope so. It's definitely a great part of my day when I get to record these. So hopefully it'll be energizing for everybody, including you, the watchers and listeners. Hope you'll enjoy the show today. Starting off with, so if you've been listening episode by episode, you know that I've been experimenting a little bit with the way we do the kind of the beginning portion of the episodes. Dr. Joy, we're going to play the warm-up game now. And the warm-up game is, it has two stages. The first stage is I would like you to select a number, well, three numbers from 1 to 10. So select 3 from 1 to 10.
2, 3, 7.
2, 3, 7. The categories you picked is food, travel, or talent. And then which category would you like? And that's going to dictate your question.
How about food?
Food. What is your favorite meal in the world? Favorite to cook or something that brings back memories?
Oh, wow, that's a tough one. I love to cook, and I also love preparing food for other people. I guess I would answer it in a little bit of a different way. So one of the things that we do at Health Topia is we have group visits where we help people with some of their health issues by getting everyone together in a more social setting. And we often address eating because that's an important part of health, and part of eating is cooking. And so we will basically take a recipe that somebody has that's something from their family, something that's been passed down, or like a really special recipe, and we'll remake that recipe in a way that's healthier. So, for example, we might take something that is like a lasagna, for example, and instead of pasta, we'll use like zucchini to make it healthier and less carbohydrates. Or we might, instead of using ricotta cheese, we might use like a homemade cashew cheese, so it's more like plant-based, to help bring down cholesterol, but still get like the same great flavors. So I'm really passionate about teaching people how to cook healthier, but also making the food delicious. So I don't know if that's the answer you were expecting, but that's what comes to mind.
Okay, that's really interesting. I'm glad you mentioned that. And it is partially what I expected. On this show, though, we make it a point of also learning just a little bit of the, non-professional side of the guests. So would you be willing to tell us a little bit about your favorite food outside of Healthtopia?
My favorite food. I mean, I pretty much have never met a vegetable I didn't like.
Mm,
So, I like to make at home, just kind of whatever's in season, making bowls. So sometimes it'll be something from my garden, or, whatever I have left over in the fridge, something that I need to use before it goes bad. And I'll often just kind of do like sautéed vegetables and some like fresh things and kind of throw it all together, almost like a salad, but some of the things are warm. So that's my favorite way to eat.
okay, that's awesome. So which would you say is the most underrated vegetable that people are sleeping on and they should give it a shot?
Man, I probably spaghetti squash.
Okay.
They're usually kind of on the larger side, they're hard to cut, I need my husband to help me when you cut it in half, but when you roast it in the oven and it gets soft, you can scrape it and it almost makes like noodles, and it's just, like, kind of a great healthy substitute, but it's also really tasty.
Wow, that's amazing. I haven't heard of that being called spaghetti squash. I'll be honest, I've looked up pictures online just now. I'm looking at them. I have seen this in the stores. Some people just take it for like purely decorative purposes, but I did not know that you could cook it that way. That's awesome.
Yeah,
Yeah.
it's something you can get really creative with.
I can see that. Well, that's something that I'll have to research after the show. Love to learn from our guests, and thank you for answering the warm up question. Uh, I always wonder what we're gonna get. It's exciting for both myself and the guests. Alrighty. Speaking of traditions of the Scaling Practice Management podcast, the next step on our journey is for you to answer the traditional question of the show, and that is, what is your number one tip for successfully growing a healthcare practice? I'm really curious about your answer.
I think it's a positive culture,
Mm-hmm.
honestly. I think that really for any organization, but especially in healthcare, it's about healing, it's about taking care of people, and I think that starts with our employees. And so for me, the most important thing is as a leader in a healthcare organization, that I set the tone and set the example for how other doctors in the practice or managers in the practice interact with staff, interact with ultimately patients as well. And I think if we can keep the focus on being patient centered, talking about what is in the best interest of the patient, everything really flows from there. And also, like I said, just really keeping a positive demeanor, trying to be there for one another and taking that really to heart. It sounds kind of cliche, but I do think it is the most important thing, because especially in healthcare, it really is about how we interact, like how we nurture, how we heal, and that has to start with the top level of the organization, and it makes, I think, also a very big difference in, like, how we not just interact with each other, but, like, create a space, that promotes healing, that people feel comfortable, that people feel welcome. It's essential and core to what we do.
Yeah, I'm really happy to hear that answer. And we've talked about leadership a couple times on the show already, and I'm happy to hear that there's this huge level of responsibility that leaders in healthcare are taking, and this thought that the model comes from the top, and people look up to the leaders to kind of model their behavior and demeanor, as you said. That's something that seems to be a popular sentiment. The key question, of course, is how. Do you have any tips, from your end on how to keep a positive demeanor, how to be a good model for the rest of the team? Because it's not always easy, right, with the pressures of leadership to keep that positive face.
I think you just have to be a strong person,
Hmm.
What we signed up for is not easy, and especially with some of the challenges that we're having in the healthcare system right now, it can lead to burnout, there can be frustrations, but those are things that, we can try to alleviate by talking about them with our colleagues in a way that's, like, positive and productive. But at the end of the day, like, when we're taking care of people, we say patients, but I like to say people, we have to put all of that aside. Like, you can't really bring that into the exam room per se, and we just have to be really excellent at how we conduct ourselves and how we do our job. I don't have a lot of tips, I think it's about character. I think
Right.
that the biggest tip I can give anyone is, to try to work on yourself continuously. I try to work on myself continuously, and if you make a mistake, acknowledge it. If you have a bad day, we wake up the next day and try to do better. I mean, that's all we really can do, and like I said, it doesn't matter if you're the CEO of the organization or you're the receptionist at the front desk. We all have to have that same mindset, and like I said, it's not easy. It takes grit, it takes commitment to the mission, and constantly reminding ourselves of why we're here, which is to be in service of other people.
Do you mind if we pull on this thread a little bit more then? Because I feel like a lot of the watchers and listeners are going to hear this and think, working on myself, that's something that I've neglected. I'm not finding the time for it. What do you do to work on yourself that's worked for you, for example?
I mean, part of it is, like, work-life balance, right? Like, carving out time for things that can help us decompress. For me, that's spending time with family, cooking, as I mentioned earlier, exercising, things like that. But I really think it's more about mindfulness and self-awareness and kind of, being able to take a step back and be objective about our own thoughts and our own, like, words and our interactions with other people, and just constantly being in the mindset of, like, reassessing that. It's not something that people can do overnight, I would say. It's
Yeah.
just kind of opening up our minds to an awareness that we are not perfect, and being willing to receive feedback, being also willing to, like, look back on our day and say, like, "What did I do well? What could I have done better?" And just have kind of making that a daily practice.
Yeah, that's definitely a skill. And building a good culture of feedback is important as well. But just personally receiving feedback, being able to internalize it and taking it with grace at the same time, in some areas, standing firm on what you believe in. I think, as I say these words, a lot of the watchers and listeners are thinking of situations of various kinds that kind of relate to that. So I'm wondering, I think, as you were talking about this, I'm thinking of the various things that one can do to improve, for example, their mindfulness and self-awareness. I suppose there's meditation, maybe therapy, maybe journaling. Any of those that you've tried or want to promote, or anything specific you would call the audience to do here?
Some of the people that listen to my podcast, if you've heard me talk about it before, I do enjoy writing. It's a creative outlet for me, and I do highly recommend it for anybody that wants to give it a try. Writing, I think, is, for me at least, a form of mindfulness. It's something that is becoming a daily practice for me. When I was in college and medical school, when I would write, it would be more with purpose, like to answer an essay question or to write a journal article or a research paper or something like that. This kind of writing I'm talking about is really different. It's self-reflective. It's more like in the vein of memoir or personal narrative. And the daily practice of writing is not necessarily with the purpose of publishing everything you write. It's to cultivate the skill and also to give yourself that moment of reflection and kind of being with yourself and your thoughts. I find that when we write, we process things differently and we can find insights that are hard to see, like when we're kind of caught up in our day or caught up in some of our challenges. But writing it out and kind of trying to explain it on the page it can be healing. It can be, like I said, a way of self-reflection, and it can be fun. So I encourage everyone to try that, even if it's just 15 minutes a day, just kind of, starting your day with just writing something, getting it off of your chest, clearing your mind can be really helpful.
Yeah, and it's definitely becoming a bit of a lost art these days where, I mean, even I feel the temptation and sometimes to come to it. I'm not going to journal with my own thoughts, but I do it with AI, for example. And on the one hand, it can stimulate my thinking a bit. On the other, I have this internal feeling that I know I could benefit more if I let my own thoughts have more of that space, you know? But I'm glad we landed on something that the audience can really try here. For myself, I do gratitude journaling daily. And that's a practice that I've held for almost 10 years now, which is kind of mad to think about. But I do recommend it. It really changes this perceptive filter that you have on your daily life. Like, what am I going to put on my list at the end of the day? Sometimes I even look around my apartment and I'm grateful for the roof over my head, for having, I don't know, access to a cell phone, the stuff that, although, phones have a very mixed reputation these days, there's a lot to be grateful for if you look for it. And thank you for digging into that with me. I have one more thread to pull on here on the subject of culture. It's something that I had in the back of my mind to talk about with you either way, based on our previous conversations. What do you think are the elements that really build the culture? What I mean is, where do you think culture sits in like the small day-to-day interactions at a healthcare practice? Is it in the way you have conversations, in the way you write emails? Probably there's obvious and less obvious places where you can influence the culture. So I wonder what you would draw the leader's attention to in this particular respect.
I mean, I think it can be so many things. The list is almost endless. Even from the moment that someone walks through the door, what is their experience, right? Like how how is your office even laid out in a way that like creates a comfortable space? Do you greet people? Is there a human being that greets people when they walk through the door? Do you know who they are? Are people anonymous or are people familiar? Do people know your name? All of those things kind of set the tone, and I think it's basically interactions with people that we're taking care of. It's the interactions with each other. I think those are the things that set the culture the most, but, like, even, like, how you choose to structure your organization, like the reporting structure or what kind of benefits that you offer your staff, like how you prioritize, your expenses, those kinds of things can all set the culture. I mean, one of the things that as a small company that we decided from the very beginning is that we were gonna offer health benefits
Hmm.
to our staff, even as a young company when we just had, like, a handful of employees. So, that's obviously a big expense, and it continues to go up in cost every year, and it seems never ending in terms of how much it goes up in cost, but, I didn't wanna be running a healthcare organization and not feel like the people working for me had the healthcare that they needed, for example. So, like, that's an example of culture. But, yeah, I mean, it's I think where people feel it the most is in the human to human interaction.
Yeah, I can definitely sense a lot of truth in that. I wonder what you would say to somebody, a team member perhaps, who comes up to you and says, "I understand that the positive culture is important. It's important to always have a smile when you interact with patients, but it's people." You would say people, not patients. But it's hard sometimes. It's there's a lot going on. We're overburdened and burnt out. And how do you actually make that work? What would you say to a team member who would be kind of either worried about that or talking about their capacity to keep that positive culture going?
Wow, that I mean, I think that it starts with recruiting and hiring, we try to
Oh,
recruit and hire people that are already in that mindset, but if somebody's struggling and they're coming to me, like, honestly saying, like, "I'm having a hard time," then, like, the way to perpetuate that culture is, like, to be there for that person, to try to help them figure out, like, how to maybe they need time off, maybe they need some other resources to help them. I would try to look for what the root cause of that is, because I think, generally speaking, everybody that we interact with that would work for us, like, wouldn't have a mindset of being negative intentionally, it
uh,
would be,
right.
because there's some other external factors or sometimes internal factors that are creating challenges, and so, I would approach it from a healer's standpoint, like, how can we get to the root cause of this? What kind of resources can I offer? How can we give you support? Do you need a break? Those kinds of things, and I think by being that mirror and kind of, like, reflecting back, like, kind of a nurturing approach, it's sort of, like, inherent, right? It's then becomes, like, kind of contagious.
Yeah, I understand. It's interesting how I think how you approach this. That it starts, already at the hiring stage, and that's definitely something that I didn't think of as I was asking the question. So thank you for including that in your answer. Okay, so I had this feeling to stay with the number one tip and digging a little bit more into culture, perhaps today compared to some of the other previous episodes. But thank you for exploring that together. And next, I would love to ask you a couple questions about Healthtopia. So I know from our previous conversations that you're building something a little bit different, so kind of bridging the gap between traditional medical care and integrative medicine. So, could you explain to our watchers and listeners what that entails, the scale of your practice, and talk a little bit about that?
Sure. So, Health Topia is a essentially primary care practice. Our physical locations are based in Southern California. We have 4 brick and mortar physical locations. We serve about 35,000 patients. Our model is kind of unique in the sense that we really believe that primary care can serve the needs of people through a variety of different things that would typically be siloed kind of in their own like vertical in healthcare. So urgent care, for example, we feel belongs with primary care. Also integrative medicine, we believe belongs with primary care. And so we have created a care model that really brings urgent care visits and primary care and integrative medicine all under one roof, kind of in one seamlessly integrated care delivery model.
And can you tell me more about what the impact of that is? So, from the perspective of a potential patient, what does that mean for them? What's the benefit to them?
The benefit to them is number one, access, because the way that we've structured our scheduling, we take same day appointments, we take walk ins. We don't say to people, oh, you're here for this particular issue, this other problem that you have, we'll deal with that. You have to schedule another appointment for that at a later time. We don't function that way. We kind of, our approach is really whole person care and seeing the person as a whole individual. So we not only want to address all of those different things in the context of one visit, but we encourage it because a lot of times body systems are interacting with each other, and it can be important to have that context. So, yeah, I don't know if that answers your question, but we, I think are trying to solve 80% of what people need kind of within our walls, and then that 20% might be, referrals to a specialist. Occasionally, if someone's really ill, they may need to go to the hospital, but we're trying to focus on prevention and trying to improve access, trying to offer solutions that are kind of getting a little bit more upstream. And so we're intervening before disease even develops using integrative techniques, but also conventional techniques and kind of blending all of those things together. So like if you're a person who's experienced having and this is very common here, especially in our, I don't know, I mean, it's, I would say across the whole United States, but especially in our community, access is a big issue. If you're somebody who's experienced interacting with a larger health system and it's like, could be 6 to 12 weeks to get an appointment with a primary care doctor, we have literally can schedule people to establish care within 24 hours or less. If you've experienced going to your doctor and feeling like you wanted to talk about supplements or kind of a more preventative approach and it just wasn't their area of expertise, and then so you go to like maybe a naturopathic doctor or a chiropractor or someone that does more kind of an integrative approach to things, they may not have the same scope and expertise to deal with all of the health issues that you have because their focus is more on the prevention. So I think it's also from a benefit standpoint, you're getting all of those services in a way that's cohesive in one place where we can really see the whole picture and address all the issues at hand.
Okay, yeah, I understand. So you're talking about this whole person approach. What comes to my mind is, this is, for example, about passing data about the patients. So, for example, if it's all under one roof, I understand, you've got a fuller picture of how you can take care of your people. I wonder if there's anything more here that you see as the benefits of having, this more holistic approach, especially on the integrative side of things. Could you paint a picture of what this might look like for a patient, or just I'm also curious about, what motivated you to actually the why behind building a Healthtopia in this way.
Yeah, I mean, well, I think the benefit to the people that come to our practice would be that we're not we're not just waiting for disease to happen, we're being proactive. And
Mhm.
so A lot of the visits that we have are really with a focus on prevention. When we look at labs, for example, we'll look and see if not just they're really out of line, right? But if they're slightly off, like what is the trend looking like? And how can we say use diet and lifestyle interventions to curtail a trend that is going in the wrong direction? And so the benefit really is less burden of disease for our, you know, for the whole population that we serve really is I mean, that's the goal is to instead of, focusing I mean, obviously, we address if someone comes in and already has, like, a health issue, we're gonna address that, and we're gonna bring in conventional approaches most of the time if it's already to the point where, like, disease has developed. But simultaneously, even in that situation, we're gonna layer in lifestyle things, supplements, nutrition, sleep, stress reduction, those kinds of things that can really help move the needle and create an environment and kind of a mindset of healing, and also prevent further disease from developing.
Okay. And how do patients typically react to that? I wonder. Do they take it in a positive way, or are they surprised that, for example, they're being referred to a chiropractor, or you're talking about sleep quality? Do they ever say, "Just give me the pill," and the medicine that will solve my problem, or how does it usually play out?
I don't really think it plays out that way because we really like I said, we are person-centered, and so we're trying always to address issues in a way that is in line with a person's value system. So if the person is really not open to any, like, lifestyle changes or integrative approaches, that's okay too. I mean, we can prescribe medication. That's not, something that we frown upon either, and in certain circumstances, it's necessary. I think over time, as people come to our practice and they kinda see what our approach is, they kinda become we call ourselves Healthtopians. People kind of become Healthtopians over time because
Okay.
they see kind of the positive benefits, and a lot of times too, people are coming to us because they're looking for that kind of blended approach where they can have a doctor that's gonna care for you know, them from a standpoint of all of these lifestyle elements and things that really kind of move the needle on health, not just disease care, but health care, right? That people are coming to us because they want someone with that mindset, to be in charge of their health. So, yeah, we don't have those conversations very often because, like I said, our culture is really to listen and to understand what the person wants to do and what works for them. Our job is really to educate on what the options are, like what are all the different things that we can bring to bear to help resolve or solve whatever the problem is. And also, with that mindset on like preventing problems from occurring in the first place. But really what we do is we just have more tools in our toolbox. Like we
Mm,
kind of lay it all out. Okay, here are the different approaches we could, for example, I'll just give you an example because I think it makes it easier to understand. If somebody comes in and they've had, annual routine screening labs, and it looks like their blood sugar's running a little bit high, but they don't have diabetes, so they'd
mhm,
be maybe in that early prediabetes range. There is some research out there that would say, like, jumping straight to medication, like using metformin, is being used a lot in longevity now. That's an option that's potentially on the table, but there's a lot of other things we can do before we jump to that, right? Like and we aren't in a stage of illness where it's time sensitive that we intervene, right? We have more runway because 'cause we're looking at that trend starting to kinda go a little bit in the wrong direction, so we can work on things like eating less carbohydrates, getting more exercise. There's also supplements that we can recommend that can help regulate blood sugar, so we're kinda intervening at that stage, and like I said, there's always options on the table. Another option is to do nothing, right? And to
mm.
recheck it and see what happens. But it's that kind of shared decision making and conversation with the individual, which way they want to go. And like I said, our job is really just to inform people about options and likely outcomes of what path you choose, and then kind of go from there.
A lot of what you're saying is, and this might be a total miss, but I'm tempted to ask the question anyway. A lot of what you're saying is reminding me of the direct primary care model, to be honest, when you don't come in just when you're sick or need an intervention, but you're kind of continuously being taken care of by your practice. I was, I'm curious to ask you, is that something that you've looked at or considered, or do you have a different stance towards the approach here?
When I hear direct primary care, like to me, what that term means from like a health policy standpoint
Uh-huh.
is something maybe different than what you're describing. It it has more to do with how the care gets paid for. So, like, most of the time people are using their insurance when they're going in to see the doctor. In direct primary care, you essentially are paying a membership fee,
Yeah.
and that membership fee is paid monthly, and it includes a certain set of services. I don't really to me, that the model of care isn't that the model of care is what you make it, right? It's how you practice, not so much how it gets paid for. I think one of the perks of a direct primary care model is that you have more flexibility on what services you can include in that membership fee, because in an insurance model, you can only get reimbursed for services that are covered as defined by the insurance plan. In direct primary care, for example, like in that example that I gave, if somebody wanted to do like a trial where you wear a continuous glucose monitor for 14 days and just to see like what am I eating that spikes my blood sugar the most, and just kind of getting that learning and feedback.
Mhm.
Okay, that's not something that will be covered by insurance, right? But it's something that could be included in a package that you could structure under a direct primary care model. So I guess it can influence like how we practice, but like in our business model, somebody that wants to do a 14-day trial of a continuous glucose monitor would have to pay out of pocket for that. Obviously, that's not going to be covered by the insurance for somebody that doesn't actually have diabetes, but they can use their insurance for visits, to do their annual checkup, for example. So I think the challenge, though, is that most people can't afford direct primary care.
I see.
It's for people with extra disposable income that can afford to invest in their health, which is wonderful. But our mission really is to make high quality care accessible for everybody, and direct primary care is, something we've thought about, but not something that we've really pursued. Just because we were trying to be an example of how you can really create an excellent model for primary care that brings in integrative medicine, but doing that within the constraints of what's affordable.
Okay. I'm very grateful for that answer, honestly. I'm coming off the back. I consider myself a truth seeker on this podcast, okay? Honestly. And I'm coming off the back of an episode that was all about direct primary care with a direct primary care organization. And I was looking for another look on this side of things. And thank you for satisfying my curiosity for, another perspective on this topic. Really, really grateful for that. So coming back to Healthtopia, I was wondering, one thing that also dawned on me in terms of building this show is that we're talking to the people who are really running the operational nuts and bolts of their practices, the day-to-day operations, how you make it run, how you structure the team, how you structure the day-to-day. And I was wondering if you could talk about that through the perspective of Health Topia. Under the hood, what do you think have been some of the best choices that you've made in terms of how to run this thing, how to make it run smoothly, make it scale, make it efficient? What comes to mind for that?
Yeah, that's a great question. So I think first and foremost, myself and our chief operating officer were both board certified emergency physicians. And so speaking of culture, right? The culture of an ER doctor is you see whatever comes through the door, right? You just you
Hmm.
just do it. Um, and so I think coming in with that background, I worked in the ED for 11 years. It was a mindset of just taking care of whatever walks through the door, right? And not being constrained by having to stick to a schedule all the time, and having kind of that mindset of flexibility, which is what allows us to offer walk-ins and same-day appointments layered on top of our existing schedule. And so the way that we set things up is that we schedule our appointments at either 20-minute intervals or 40-minute intervals, depending on how much time we need. It may seem like a lot of time to some people. It may not seem like a lot of time to some people, kind of depending on what perspective you're coming from. But in primary care, that those are longer appointments typically than what you would find in a normal primary care environment, where you have oftentimes 15-minute appointments is more typical. We do that so that we can spend more time with people, but it also builds in a buffer into our schedule that allows us to squeeze in walk-ins. And
Hmm.
so it lets us say yes to people that have urgent needs. And so we've gotten really good at being flexible with that. Another thing that I think is really a distinction in how we do things is that we have integrative providers, naturopathic doctors that work alongside of our conventional MDs and mid-level providers. And we really approach it from a team-based care perspective. So we put our heads together on cases. We leverage each other's expertise. We teach each other. We have a culture of teaching and education and continuous learning. We have built a curriculum for our providers so that even if someone comes to us as a new hire that doesn't know anything about integrative approaches, we help to educate them over time. And then even for the providers that have been with us a long time, we have kind of a cadence of continuing education and like case review and things like that, where we're always getting together as a team and talking through clinical scenarios and hearing how one person would approach it from a conventional standpoint versus from an integrative standpoint, how our naturopath might approach it, and how can we blend those approaches in the best interest of the person. So that is really unique. I don't know that that's something that is easy to find anywhere. I think that it's also the thing that makes what we do scalable because of the curriculum that we've built and the educational tools that we offer.
It's really, really interesting. So to pull on one of the threads here, how do you execute the education piece? Is it, monthly workshops or consultations on particular cases? I wonder what this looks like really in practice.
Yeah, so it's a combination of scheduled time, like, that's protected for us
Mm-hmm.
to have, like, kind of an educational conference or case presentations. It's also we have an internal communication mechanism that lets us, in a HIPAA-compliant manner, do on-the-fly curbside consults of our colleagues. So for example, like we have a naturopathic work group that I can send a message to if I find literally in the middle of seeing someone that I think would benefit from a certain approach and I'm not sure about something. I can query our naturopathic work group. Same thing, if for example one of our integrative colleagues or maybe even one of our mid-level providers has a more complex question about conventional medicine for a patient that they're seeing, they can query whatever appropriate, work group, and they get instant feedback. So, it's kind of a combination of structured education, but also on the fly kinda ability to really practice team-based care, like, in real time.
Yeah, I really love that, and it's a very interesting picture that you're painting here. Can you say a couple words more about team-based care and what that entails? So, again, I'm wondering what it looks like in practice. Is it consulting on particular cases? Is there more that could come into the picture here? Mostly just to see, what other practice managers might take from this as inspiration.
Yeah, I mean, to me, I mean, it's I guess it's sort of a vague term and it's used in a lot of different ways, but
Hmm.
generally speaking, to me, what it means is we as the providers, the doctors and the nurse practitioners in our practice, we function as a team. So it's not like like if a person say comes into our practice and is seen by me, for example, and then the next time they come in, they're seen by one of my colleagues, that the care that we deliver the care still in a way that's seamless. So we share notes. Sometimes it also means that, like, we leverage the expertise of, like, different individuals depending on what that person needs. So, for example, if I'm seeing somebody, say we'll go back to that blood sugar case. I'm working with this person on a combination of conventional approaches and integrative approaches, and it gets kind of beyond my expertise and kind of like, say, the questions they're asking about various kind of specific things about certain supplements, for example, that may be kind of more in the area of expertise of one of my naturopathic colleagues, then the person might want to establish a relationship with that naturopathic colleague. And we're both kind of tackling the problem, but from different angles and at the same time putting our heads together on the case. Yeah, versus like, the typical model would be you have your primary care doctor, you go in, if they feel like you need some additional kind of support, they kind of send you to see the specialist or somewhere else. But there's not always that feedback loop and kind of shared thinking around like how do we solve this problem together? So hopefully that makes sense.
It does. It does. The picture that I'm primarily seeing here is that when it's all under one roof, all these brains under one roof, the information flows more freely, and it's more accessible. So that makes perfect sense to me. Dr. Joy, so the last thing I wanted to touch upon that I could not miss in an episode such as this is to talk for a couple minutes about the podcast. Your doctor wants to quit. Typically I ask my guests to kind of plug, where you can find them, etc. But here I would love to talk for, just a couple minutes more on that. Can you tell, because the podcast is really mission driven, really interesting. I've listened to a few episodes myself. So could you talk about the podcast? Why did you structure it that way? And what have been some of the most interesting conversations so far?
Yeah, thanks for asking about that. The podcast has really been a passion project for me. Everyone always asks me, "Are you quitting?" I'm like, "No, I'm definitely not quitting."
Yeah,
But
right. The name is
I wanted
provocative,
to
right?
yeah, I wanted it to be catchy and something that really captures the sentiment of frustration, honestly. I feel like doctors in general, there's a lot of burnout. That's a hot topic in medicine,
Mm,
right now is talking about doctor burnout and, doctors being frustrated. Really, I think what it comes down to is that our healthcare system is not functioning in a healthy way. And it really affects all of us. It affects the people that work in our healthcare system, like doctors, nurses, like every level, actually, medical assistants, all of us. And it also affects the people that have to access care in a dysfunctional healthcare system. And I think there can sometimes be like some tension that exists because, for example, like people, people that are coming in seeking health services, and then like they've got their healthcare team, trying to deliver on that. But there's kind of invisible forces that are kind of creating tension, such as,
mm,
like, for example, if a doctor wants to prescribe a medication, that medication may or may not be covered by the insurance. There might be a prior authorization process. It can take sometimes several weeks and multiple rounds of paperwork to even get coverage for that medication. And if it's not in kind of the cheapest tier of the formulary, even if it gets covered, it can still be costly. And all of those things are kind of happening behind the scenes, not visible to the person who needs the medication necessarily. And then what's happening is you've got like the healthcare team dealing with all of these, frustrations, and then the person that needs the medicine is experiencing their own version of those frustrations, but there's not like a connection between the two to kind of feel that kind of solidarity, that we're on the same team fighting for the same thing.
right.
And so the reason that I named it Your Doctor Wants to Quit is because I'm trying to express that sentiment of we're all frustrated, you know?
Mm,
Sometimes we all feel like quitting, but obviously, like from what I've shared already in this interview, and if you listen to the podcast, it's very much the opposite of that. It's really about how do we how do we change things? How do we have productive conversations so that we can foster understanding and bridge gaps and brainstorm and think about how to make things better, but also like creating an awareness for the underlying reasons for why those problems exist in the first place. Because sometimes, even if you're a doctor that's worked in the healthcare system for 20 years, like there's still aspects of why the dysfunction exists that you may not understand because you're not a health policy expert, right? And so, like we can all learn from each other and learn more and try to kind of team up. Speaking of team-based care,
of course.
to try to figure out how to fix things and make things better.
That's great, and I do really recommend the podcast. I'll be happy to link to it in the show notes as well. So if you were to direct people to one particular episode or maybe one that was your favorite, what comes to mind?
Oh, there's so many good episodes. There's kind of something for everybody. We talked a lot about integrative medicine in this episode. So if you're interested in learning more about integrative medicine and naturopathic medicine, I would recommend there's an episode called Doctor Doctor, and I
Oh,
interview it's a husband and wife, and the wife is the naturopathic doctor. Her name is Dr. Alyssa Burnham, and then the husband is Dr. Michael Turner. He's a general surgeon. And so I think that one's kind of fun because you're getting to hear their different perspectives on each other's fields and where they kind of fit in, and also how they work as a team in their marriage. Like, because there's sometimes philosophical differences too, and like how they approach even
interesting.
just raising their kids and health and things like that, but they make it work. And we talk a little bit about also too, like, where does conventional medicine really shine? Where does integrative medicine really shine? And how you kinda leverage the best of both worlds, basically.
Excellent. So we'll link to that one in particular in the show notes as well, in case anybody's interested. And I'll add it to my rotation. I don't think I've listened to that one yet, so I need to catch up on your show. Is there anywhere else you would like to direct the watchers and listeners as we close off? Anywhere they can find you, follow Health Topia?
I'm on Instagram at Dr. Joy MD. My podcast is as I think you're going to mention it, but it's on Apple Podcasts, Spotify, and now YouTube. So yeah, find me, message me. I tend to respond to individual messages. So I'd love to hear your feedback.
Excellent. Yes. And this goes for this show too, as well, watchers and listeners. If you have any feedback about this episode or any other, definitely give us a shout. I'd love to talk with our watchers and listeners. I love it when people click subscribe on YouTube and follow us on the podcast platforms, which I encourage you to do. This episode is over. We'll see you in the next one. But Dr. Joy, thank you so much for coming on the show. Really interesting conversation, and I'm really grateful to have you on the show today.
Thank you for having me. It's been really fun.
Excellent. And you watchers, listeners, thank you so much for joining us today, and I'll see you in the next one. That's all for today. This has been Scaling Practice Management. I'll see you next time. Bye-bye.